A 57-year-old patient with grade 3 hemorrhoid, it's a grade 4, sorry, it's a mistake, with grade 4 hemorrhoids with no bleeding at 3 and 11 o'clock. Which of the following is appropriate treatment? Please focus, it's a grade 4, not grade 3. What would be the appropriate answer, the appropriate treatment? We will discuss now the management of hemorrhoids so you could know how to answer the question. But as first, let's discuss now the differential diagnosis of lower GI bleeding in adults and in children. The differential diagnosis of lower GI bleeding in adults نقدر نقسمها لأربع أقسام: الأناتوميك diverticulosis or vascular like angiodysplasia, hemorrhoids, ischemic colitis, post-biopsy or bolobectomy, radiation-induced telangiectasia. العنوان الثالث inflammatory like infectious colitis, inflammatory bowel disease, ulcer, neoplastic polyp or carcinoma. لكن لو السؤال يقول what is the most common causes of massive lower GI bleeding، أول جوابين يجوا في بالك diverticulosis والangiodysplasia. اوكي طيب نروح للديفرنشال diagnosis in children. هذا الجراف من up to date، وطبعا يقسم انه الديفرنشال diagnosis بناء على العمر. فلو البيشنت نيونيت وجايني بلور جي اي bleeding I will suspect what swallowed maternal blood, necrotizing enterocolitis, malmutation with volvus, coagulopathy, Hirschsprung disease, allergic colitis, infectious colitis, anorectal fissure. طيب لو infants and toddlers I will suspect coagulopathy, Hirschsprung disease, allergic colitis, infectious colitis, anorectal fissure, lymphonodular hyperplasia, interplasial duplication, intussusception, and mechal diverticulitis. And for the preschool, intussusception, mechal diverticulum, hemolytic uremic syndrome, Hong-Schönlein purpura, and juvenile polyp, and inflammatory bowel disease. لو لاحظنا إن أنا هبدأ أشك في inflammatory bowel disease من preschool age. Okay, والschool age يعني فوق ال5 سنوات my suspicion will be less for intussusception. طيب نيجي الحين للمانجمنت of hemorrhoids. symptoms of hemorrhoids احنا عارفينها تكون bright red bleeding, there is bile around the anus and might be a pruritus. هعمل إيش هسوي كفيزيشن أو كجنرال سيرجن؟ I will do perianal inspection and digital rectal examination. لو أنا ما لقيت finding إيش هسوي؟ هسوي أنسكوبي وبروتوسكوبي. لو لقيت إن البايل هذه أو الهيمورويدز هذه below the dentate line أقول عليها external hemorrhoids. لو above the dentate line هقول عليها internal hemorrhoids. في حالة external hemorrhoids والfirst and second degree of internal hemorrhoids I will do what? conservative treatment. هعمل lifestyle modification إن أخلي البيشنت يقلل الريسك فاكتور اللي تعرضوا للكونستيبيشن. يعني هقول له خذ فلويدز كتير، استخدم ممكن stool softeners and sitz bath. If the symptoms is persistent or the patient suffer from third grade of hemorrhoids, that means he is manually reducing the hemorrhoids, I will do non-surgical procedure like what? Rubber band ligation, sclerotherapy, infrared coagulation. But if the symptom is persistent or the patient suffers from the fourth grade of hemorrhoids اللي هي irreducible, I will perform surgical treatment, arterial ligation, hemorrhoidectomy, or hemorrhoidopexy. Now let's go back to our question. A 57-year-old patient with fourth grade hemorrhoids, what you will perform? Okay, excellent. The patient is fourth grade. So بما إنه هو fourth grade hemorrhoid, I will proceed to surgical treatment.